And hundreds of Hoosier healthcare providers signed a letter to Governor Eric Holcomb. They're asking him not to call a special session on abortion if Roe versus Wade is overturned.
Fox 59 State House reporter Kristen Eskow joins us live here in studio after speaking with physicians on both sides of the debate. Kristen.
Well, Max and Aaliyah, so far more than 300 physicians and other healthcare professionals have signed the letter, which raises concerns about the potential consequences of an abortion ban. This comes after a leaked draft opinion that shows the Supreme Court may allow states to choose their own abortion restrictions.
There's no coming to the middle on it.
Wearing their white coats to the State House, these medical professionals have a message for Governor Eric Holcomb. They argue banning abortion would be bad for Hoosiers' health.
So we worry about increased morbidity, maternal mortality, infant mortality.
Dr. Allison Case is a family medicine physician and an abortion provider through a clinic. She joined forces with the Reproductive Health Access Project to help write and deliver letters to the governor, urging him not to call a special session if Roe is overturned. She points out several prominent health professional organizations, including the American Medical Association, support abortion access.
If a pregnancy is carried to term and that person is in danger of having some kind of complication, that could leave the infant without a mother. So we have to ask ourselves, what are we trying to achieve here?
Earlier this year, Republican state lawmakers sent a letter to Governor Holcomb asking him to call a special session if the Supreme Court overturns Roe v. Wade. So far, they haven't revealed what their plans would be should that happen. Some Indiana doctors say they would support an abortion ban.
The part that I see the most are mental health complaints and symptoms that people have carried for many years after abortion.
Dr. Andrew Mullally is a family medicine physician in Fort Wayne who is active with Right to Life. He believes healthcare providers and lawmakers should focus on resources to help expectant mothers as alternatives to abortion.
Some people need help making a plan, whether it's going to be a plan to raise a child or an adoption plan. Other people have physical or mental health issues, drug abuse.
The doctors at the State House today tell me they also made a request to meet with the governor, but never received a response. Now, we've reached out to the governor's office and Republican lawmakers to get their reaction to the letter. We're still waiting to hear back. Kristen Eskow, Fox 59 News.
Kristen, thank you.